Hello dear friends, welcome to my channel. So in our previous class, I have just demonstrated the relations of axillary artery on the whiteboard, and today I am going to show the relations on the screen. Before going to see this, please subscribe to my channel. So coming to the relations of the axillary artery, the three parts and its relations. First of all, every one of us must know what is the first part, second part and third part. In this picture, you can identify this muscle is nothing but pectoralis major that we have separated from the clavicle and the sternum and from the ribs, and also the aponeurotic fibers also have separated and reflected it upwards and laterally, so that underneath it we can identify this pectoralis minor. Then coming to the three parts of axillary artery, the first part is present above the pectoralis minor, second part is present under the pectoralis minor, third part is present below the pectoralis minor. So this is how the three parts are present. First part, second part under the pectoralis minor, third part is present below the pectoralis minor. Now moving to the first part relations. So we are going to see the relations from outside to inside, outside to the inside. So here in this is the region called as pectoral region, and this is called as axilla. Now after first and foremost relation is when you are going from outside to inside, the first thing is the skin. Then soon after that skin, this is the skin. After refracting the skin, we can identify this yellow color layer that is nothing but the superficial fascia which is present over here, and also the cutaneous nerves which are present in this particular area. They are nothing but supraclavicular nerves. Supraclavicular nerves, and this is the platysma muscle fibers which extends down. They are also the anti-relation of the first part of axillary artery. And the next relation underneath the superficial fascia, we can identify the pectoral fascia that has also have separated, and we have exposed the pectoralis major. So three relations which we have reflected: skin, superficial fascia, then pectoral fascia we have reflected. Underneath the pectoral fascia, which we can identify this large muscle is nothing but pectoralis major. Pectoralis major, that is also we are going to reflect it. Pectoralis major, and after separating the pectoralis major, where we can identify the clavipectoral fascia, clavipectoral fascia. And clavipectoral fascia, in this clavipectoral fascia we can see that cephalic vein is present anterior, cephalic vein, and the thoracoacromial vessels which are the anti-relations of the first part of axillary artery. This is clavipectoral fascia, and here you can see the first part of axillary artery. And then in front of that we can identify sometimes this loop, the loop which is communicating the medial pectoral nerve and the lateral pectoral nerve, that is also the anti-relation of the first part of axillary artery. That is a cephalic vein. Now moving to the next part. So here in this picture I can show the thoracoacromial vein, which is also an anti-relation of the first part of axillary artery. Then what is present posterior? So the posteriorly we can identify first and second digitations of serratus anterior, and its nerve supply of the serratus anterior is nothing but the long thoracic nerve. These two serratus anterior muscle fibers and the long thoracic nerve, which are the post relations of the first part of axillary artery. And then we can identify there is a cord which is running behind the first part, that is nothing but the medial cord of brachial plexus. So the medial cord of brachial plexus, which is exactly present posterior to the first part of axillary artery, then that medial cord which comes medial to the second part of axillary artery, that we'll see in a few minutes. This is a medial cord which is present behind the first part of axillary artery. is coming to the medial relation of the first part of axillary artery is nothing but the medially we can find the axillary vein. This is nothing but the axillary vein, which is the medial relation of first part of axillary artery. Then what is present lateral? And laterally, what we can identify are the two cords of brachial plexus. This is nothing but the lateral cord of brachial plexus and the posterior cord of brachial plexus. This is the posterior cord of brachial plexus. So the two cords of brachial plexus, one is lateral and the posterior. These two cords are present lateral to the first part of axillary artery. Lateral to the first part of axillary artery. Then moving to the second part antirelations. Same thing which we have seen earlier, but here little difference is there. First we'll see the skin, underneath the skin, superficial fascia, this yellow color layer. Then we can identify the pectoralis major also, it is an antirelation, and the pectoral fascia which is covering that pectoralis major, there is a deep fascia. Then we can identify the clavipectoral fascia, and that clavipectoral fascia which is covering the pectoralis minor is the pectoralis minor. Here you can see the pectoralis minor. So this pectoralis minor is covering the second part of axillary artery. In order to see this second part of axillary artery, we need to cut the pectoralis minor and reflect it upwards and laterally so that we can see clearly the second part of axillary artery. So these are the antirelations of the second part of axillary artery. Then what is present behind? So behind or posterior to the second part of axillary artery, what we can identify are the posterior cord of brachial plexus. This is the posterior cord of brachial plexus, which is exactly present posterior to the second part of axillary artery. Then the muscles which are present behind the second part of axillary artery is nothing but the subscapularis muscle. Here I have just colored it. This muscle is nothing but the subscapularis muscle. That is a post relation of second part of axillary artery. And laterally we can identify the lateral cord of brachial plexus, and medially we can identify axillary vein and also the medial cord of brachial plexus. Here I have not shown the axillary vein, so in order to see the main structures clearly, so I have removed the axillary vein, so I can show the medial cord of brachial plexus over here. Obviously this axillary vein, it is exactly related to the medial to the axillary artery throughout its course, so you can write the axillary vein also as the medial relation of the axillary artery, second part of axillary artery. Then coming to the third part of axillary artery, what are the structures are present anteriorly? Same thing here also. One is skin, then you can identify the superficial fascia, and then pectoral fascia, and that pectoral fascia which is covering the pectoralis major, and the clavipectoral fascia. This is the clavipectoral fascia. Then under the clavipectoral, now exactly anterior to the third part of axillary artery, we can identify there is a nerve which is running in front of the third part of axillary artery. That is nothing but the medial root of the medial cord, which is running anterior to the third part of axillary artery, and it is going to join with the lateral root of the lateral cord of brachial plexus in order to form the median nerve. So the strictly anterelation of the third part is the medial root of median nerve. Then what about the post relations of the third part of axillary artery? So the third part of axillary artery post relations are, one is the latissimus dorsi, subscapularis muscle, and the teres major muscle. Three muscles you have to remember the post relations of the third part of axillary artery. This is the latissimus dorsi, and here you can see the teres major, and underneath it we can identify the subscapularis muscle. And the post relations of the third part of axillary artery are the radial nerve. So this radial nerve, which is running downwards and laterally and enters into the lower triangular space, before it enters into the lower triangular space, it is exactly present posterior to the third part of axillary artery. Then other nerve, if we just move further upwards, there we can identify the posterior to the third part of axillary artery is nothing but the axillary nerve. Axillary nerve. Then lateral to the third part of axillary artery, what we can identify is the trunk of median nerve, which is exactly present lateral to the third part of axillary artery. This is the trunk of median nerve. And the lateral root of lateral cord is also the lateral relation of the third part of axillary artery. Then other nerves are, we can identify the musculocutaneous nerve. This is also a lateral relation, and obviously as it is piercing the coracobrachialis, it also comes as the lateral relation of the third part of axillary artery. Then what about the medial relations of the third part of axillary artery? So medial relations, one is the axillary vein. So that you can write the medial relation of the first part, second part, third part is same as the axillary vein. Axillary vein is a continuously running medial to the axillary artery. Axillary vein. Then what about the structures which are present medial to the third part of axillary artery? So in this transverse section of arm, there we can identify all the structures. Even in the dissected image also we can identify. So medial to the axillary artery, third part of axillary artery, between the artery and the vein, there are two structures, two nerves are present. So the nerve which is present in front or anterior, that is nothing but medial cutaneous nerve of the forearm. Medial cutaneous nerve of the forearm. Just below that medial cutaneous nerve of the forearm, between the artery and the vein, the thicker nerve is nothing but the ulnar nerve. Ulnar nerve. Then medial to the axillary vein, we can identify another nerve. That nerve is called as medial cutaneous nerve of the arm. Medial cutaneous nerve of the arm. How to identify that is, it communicates with the intercostobrachial nerve. Intercostobrachial nerve. Second or third intercostal nerve, which is going to join with the medial cutaneous nerve of the arm, and it is applying to the upper medial aspect of the arm region. Okay, this is how the medial relations are present. And that's about the relations of the three parts of axillary artery and anterior, posterior, medial and lateral relations of the first part, second part and third part. Thank you, dear friends. See you soon in the new class.